This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. You may have heard of occupational therapy, physical therapy, but have you heard of vision therapy? Well, today we're heading over to the Aurora Vision Center in Oshkosh. We're going to be sitting down with Dr. Sandra Verhage to talk about how vision therapy might be able to help you. Well, nice to see you. Thanks for taking some time. Now, we're talking about vision therapy today. So I would imagine when I think of therapy, I'm thinking like occupational therapy or rehab or something like that. Am I on the right train of thought here with this?
Correct. So vision therapy is treatment for visual conditions that can't be treated with glasses or contacts. So it basically trains the eyes to have a better binocular vision so the eyes are more comfortable.
Okay. So is vision therapy designed specifically for a certain age group, or could it be older, younger? How does that work?
So vision therapy is used for all age groups. I have patients who are children in school, and I have adult patients who are recovering from concussion or stroke.
Concussion. So you know, a lot of people are dealing with concussion, especially the young athletes. You hear more and more about concussions. How does vision therapy help someone with a concussion?
Okay. Concussions, after a patient has a concussion, they may experience difficulty with their tracking eye movements or a sort of eye strain that can be due to the converging and diverging system of the eyes not functioning properly. So we can train those systems to improve.
Okay. What would be some of the other things outside of a concussion where a person you would see and recommend vision therapy for someone?
We use vision therapy to treat amblyopia or a lazy eye, strabismus, known as an eye turn, or other converging and diverging problems and eye tracking problems that interfere with reading.
Okay, so let's talk about some of the ways that you are able to help some of those problems with vision therapy. And I see you've got several props here to play with today.
Every patient is different, and every therapy session will be different depending on the diagnosis and the patient and their abilities at that given time. So here we have a Brock string. The Brock string is used to train convergence and divergence. It is used, basically the patient would focus on one of these fixation targets and jump between them.
Okay.
When it is in use. The vectogram and the stereoscope also are used to train convergence and divergence. And then we use these things called flippers. They have different powered lenses in them that we use to train the focusing system of the eye.
Okay. So how often would a patient need to partake in an actual vision therapy session?
Okay. We start out with an 8-week course. So the patient would come in once a week for 8 weeks and have a 45-minute therapy session.
So it's very much like a rehab session, physical rehab session as well.
Yes.
When a person goes through those 8 weeks, then what can you expect after those 8 weeks?
Mm-hmm. Well, we would expect their vergence or convergence divergence abilities of their eye to be stronger. We would expect their focusing system to have improved, and we're looking for those eye turns or the lazy eye to be improved.
Okay, so how would a person know if they need vision therapy? I would imagine somebody doesn't walk in and say, hey, I want vision therapy. Is that something that is determined through a regular exam?
We would want to start with a basic eye exam to determine if the eye problems can be fixed with glasses or contact lenses. After that, we would discuss the possibility of doing vision therapy.
Okay, and there aren't too many people in the Oshkosh area doing vision therapy, is there?
There are a few. I'm one of the few that uses vision therapy.
Okay, and you're a Wisconsin girl, I understand.
Yes, I am.
Grew up in the state?
I grew up in Racine. Yes, and then I went down to Missouri for schooling, and I've returned.
All right. Well, it's great to have you back and working with patients in the area, because you've got a lot of different things going on here at the Vision Center. Now, just to be clear, you're not in the Aurora Medical Center. You're actually across the street.
Right, we are in the 700 building across from the main hospital in Oshkosh.
Okay. And if we have any questions, we can give you a call?
Yes.
All right. And I know a lot of people are also interested. Does medical insurance or vision insurance cover anything like we're talking about here with vision therapy?
Occasionally, medical insurance will cover vision therapy. I would say about 90% of the time they will not, but we can look into that for the patients.
All right. Well, we appreciate you taking some time with
You're
us
welcome.
today. Now, if you think vision therapy might help you, or you just need your yearly eye exam, you can give us a call here at the Vision Center at 456-2000. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.